Live, local. This is Fox 12 Now.
And hello, everyone. This is Fox 12 Now. I'm Greg Nibbler, and thank you for joining us. As always, we appreciate you tuning into this show. We are live streaming on Facebook, YouTube, our website, and our apps, all great places to watch live and watch these segments afterward. And we get to have a lot of conversations on here. Certainly something that a lot of people are having a conversation about is mental health, and it is Mental Health Month. And to talk about some of the initiatives that she has going right now in association with that and some of the ways that we can tackle some of these issues that affect so many people, we are joined by U.S. Representative Andrea Salinas from District 6 of Oregon. And hello, it's so nice to have you back here on the show. And, to jump right into it, mental health is something that really encompasses so many different aspects of policies and ways that we're looking at society as a whole. It's something that I feel like a lot more people are aware of now, but those ways to tackle those issues continue to change and continue to be a big challenge. And to start off, would you mind just giving us some of the background for you as far as why tackling mental health issues is such a big concern for you?
Yeah, thank you, Greg. Oregon, sadly, is ranked 50th in terms of overall access to mental health care in the United States. Out of all 50 states in the District of Columbia, the only state that is worse off is Kansas. And I think we've seen, and everyone has seen, how mental health and substance use crisis has caused a lot of suffering for individuals, families, and entire communities sometimes. People can't afford treatment, or maybe they live in a rural area without a provider, so they can't access the treatment, or there's stigma around trying to seek help, and that all of that can prevent people from getting care. But no matter what the reason is, it's unacceptable that mental health care is so hard to access, especially when these kinds of challenges are so common. And I say this all the time, not just in the 6th District, not just in Oregon, but actually across the United States. And I know personally, from personal experience, members of my own family have struggled with their own mental health, including my sister. And it's a big problem in the Latino community. There's a lot of stigma around asking for help, and it's seen as a sign of weakness sometimes. So a lot of times family members just end up sweeping problems under the rug instead of addressing them, and these problems get larger.
So many different things that you just brought up there. I guess to talk about the first one, you mentioned that combination of sometimes mental health issues, but also substance abuse issues, and a lot of times it does seem like some of those overlap, but not all the time. And clearly, we see it with some of the homeless population, some concerns there. Obviously, a wide-ranging thing there. But how do you discern and determine what the right kind of care or funding is when it comes to substance abuse or mental health when they do cross over so much?
Yeah, so right now we are having some funding challenges in Congress. I have to be honest about that. And so, we have a really large and growing deficit, and I get that. I want to make sure we don't leave, this huge debt to our children and grandchildren. So something that I have taken a look at is trying to make sure that people have at least initial access. And so for those who are insured by Medicare or Medicaid, I have provided what I would it's called the Hope and Mental Wellbeing Act. It grants 3 free annual mental health care visits. Now, everyone knows that 3 visits to a behavioral health provider is probably not going to be the entire treatment for a person, but it will get them in the door, and it'll get them to a path, hopefully, that will get them longer term treatment. I've also tried to expand access through peer support. And this is a service that connects people who are struggling with trained professionals who have actually been through a mental health or addiction challenge themselves, and they can be uniquely equipped to help the person in recovery. And these are some ways that could be lower cost solutions for people to have access to additional providers, and they could actually expand the workforce as well.
So something that more people would be able to apply for, or at least get access to some of that help that's needed.
That's right.
Another thing that you brought up is the stigma side when it comes to mental health, and you mentioned the Latino community, but also I'm sure it affects a lot of communities as well in seeking help. So what are some of the ways that you're combating that in order to lessen that stigma and increase the possibility that somebody who is having issues is actually seeking out some of the assistance that's available?
Yeah, so I know that in our rural communities, there is a lot of stigma around trying to access healthcare, behavioral mental health care. And so I have actually targeted an area, and it's a bipartisan bill that I've brought forward with one of my colleagues from Tennessee, who's a Republican, for the farming, fishing, and forestry communities. We know that a lot of times folks who are working in agricultural industry have a harder time. They typically take on more debt. They have a lot more stress. They don't have a lot of time, and they certainly don't have the provider base, so people who can actually help them with any of their mental or behavioral health substance use treatments that they might need. And so making sure that we stand up, and it would just be a pilot program to help this particular population of folks in some of these rural communities is something that we have done through a Telemental Health Care Act. And so trying to really focus on other areas. We know the same thing for some of our firefighting community. And so I have stood up a bill, again, a bipartisan bill that would help our firefighters. We know that they have a lot of stress and trauma and sometimes don't know how to let go of it and don't have access to providers. But peer support specialists could be another area where they can learn from each other. And again, these would be trained professionals who have been through that lived experience, though, who can meet our firefighters and emergency responders where they are. And so those are some low-cost areas for particular groups that I would love to see get passed, and working with my colleagues, like I said, on both sides of the aisle to continue to work these.
I mean, something like that definitely seems like a really good thing as far as tackling some of those. And you mentioned you're working across the aisle. What are some of the, I guess, things that are inhibiting that from being passed right now? Or what are some of the challenges that you're facing in getting that enacted?
Yeah, a lot of it, I think, really is the money issue, right? And trying to make sure that we're striving to balance our budgets, and there's just a lot of resistance, I think, from some of my Republican colleagues who don't really see the need to invest more right now. I do. I think this is an issue, and I've heard it from my employers and folks who are in industry who need more workers, but a lot of times they see that mental and behavioral health issues prevent people from being fully employed and coming back to work. So that's been a big issue, I think, for employers, and making sure that people, once they are employed, remain healthy and well. And this is about wellness. This is about making sure that mental health is put on par with physical health, because we know they're very much interconnected and you can't have one without the other. I always say for some reason, providers and insurance companies and, some of our public health insurance doesn't include the head up issues. So sometimes dental, vision, eye, and obviously mental health. And those are things that are needed. It's part of regular healthcare. And that's what we have been trying to really stress this month with mental health awareness.
Well, since it is Mental Health Awareness Month, Mental Health Month, and people are certainly aware of a lot of things. I don't know if everybody was aware how low Oregon ranks when it comes to that. And given how low Oregon is ranked when it comes to mental health care, what is something that you think every Oregonian should know about this, and what can we do, even just as a general person in the public, to help alleviate some of those concerns?
Yeah. So what I tell everybody is, first of all, raising awareness is a huge first step. And knowing that we are afflicted by mental health issues and don't have the type of provider base that we actually need for our communities is huge. But everyone should know that there is a nationwide phone number to call. It's the 988 Crisis and Suicide Hotline. And so if you or a loved one is in distress, you can absolutely call 988 for free and confidential help. And that is something that I worked on actually in the legislature, and the Congress passed in the last congressional session, so in the 117th Congress.
So something that everybody can call right there. And I think my last question is, you're working on the federal level and working in that caucus and working to get that passed. But to me, it seems like it's also something that needs a full, from the top down, attention. And so when it comes to that, are you working with some of the city governments, county governments, local officials in different areas, certainly in District 6, but maybe even beyond, to help lead this in getting everybody on board with finding more mental health care for people?
I'm so glad you mentioned that, Greg, that it is absolutely the reason this has been a focus of mine, because I think we've seen it at the state and local levels that, we don't have enough treatment facilities and residential care facilities for those who maybe are in addiction recovery or need to get off the street, get out of homelessness. And this is part of a complete continuum of care that needs to be addressed. And so absolutely, and I keep saying it's an all hands on deck moment. I think, I've heard from my local city councilors, mayors, county commissioners, that they want to be part of this solution, law enforcement, housing officials, and I think it is going to take a all hands on approach. So I am happy to continue to work at all levels of government to make sure that we are all rowing in the same direction and trying to address this crisis.
Yeah, definitely needs to happen. And as you said, awareness being one of those major things. So the more people that are aware, the more we can tackle this and hopefully provide some help to people, and which helps everyone as a whole too here in Oregon. So
that's right.
Well, Representative, anything else that you want to share just about your initiatives?
No, I'm just excited to continue to work on it. Always looking for good ideas. My door is always open, and happy to work with the community on this.
Well, Congresswoman, thank you very much for joining us. I appreciate your time in talking about this very important issue for everybody here in Oregon and for the country as a whole. But good to know that there at least are some steps being taken and worked on to try to tackle these issues. Thanks for being here.
Thank you, Greg. Be well.
Yeah, you too. And for everybody watching, again, this is Fox 12 Now, so I appreciate you joining this show. We are live here every weekday, and we cover a wide range of issues here on the show and topics and discussions. And so thank you for being a part of that. You can send me an email, fox12now@kptv.com, if you have something that you would like to see discussed here on the show, or maybe you've seen something on one of our regular news shows and you want to do a deeper dive. We've got all kinds of reporting that happens there, and sometimes they may not have time to cover every single aspect of a topic. If there's one you want to find out more about, send me an email. We can get the reporter on here. We can go deeper into that. Or really, we've got a lot of range here to cover a lot of topics. So I appreciate you being a part of this and the discussions that we get to have. Don't forget to download the Fox 12 Oregon app. Great way to watch all of the programming that we do here for Fox 12 Now, but also everything else we do here with Fox 12 Oregon. But signing off for right now, I'm Greg.